Hello, good morning, and welcome to Aging Strong, Tufts Medical Center's injury prevention and outreach program that's dedicated to sharing information and resources that empowers older adults. This program is sponsored by the City of Quincy's Health Department. Before I introduce today's guest, who is Aileen Gerhardt, who was here last time to talk about patient advocacy, I just want to share with you a brief article. Just a little bit of that article that talks about the aging population who ages in place. And it's written by the American Society of Aging. And it was a newly released article. The title is, Can the Nation's Housing Support a Population Seeking to Age in Place? And in it, their introduction states that within 20 years, 50 million households in the United States, which is a third of all households, will be headed by an individual 65 years or older. And they got that information from Harvard University. And they say the number of households headed by a person ages 80 or older will more than double to reach an unprecedented 18 million. So today's guest, Aileen Gerhardt, is going to talk about solo aging and how that is a topic or something that we need to kind of be knowledgeable about, especially if we are in that population who decides to age in place. Knowing information that can help us thrive and have the resources that we need is so important. So Aileen, welcome.
Thank you. Thank you to Tufts Medical Center and to the Quincy Health Department for the opportunity to talk about this important topic. I'm going to go ahead and get started with some slides to share information with our audience. As an independent board certified patient advocate, I focus a lot on navigating healthcare and also work with people on connecting to community, expanding support systems, all of that, because it all impacts our health as well as all of the other pieces of our lives. It happens to be that for years there have been different phrases for what now is referred to as solo agers. And unbefriended elders, vulnerable elderly, geriatric orphans, not great. Not dynamic or positive in any way. Elder orphans is still being used a little bit. And so most recently around the world is the phrase kinless. So there are articles now being written about kinlessness. And childless adult is also used. Solo seniors is often used. Solos, and the phrase solo ager was coined by Sarah Zeth-Geber, whose information I'll be citing as well. And she really wrote the first book on solo aging and has been speaking about solo aging nationally for a number of years. And so solo ager has really been the phrase that's really used the most. Now, when we say solo ager, who do we mean? So it's an aging adult 55 plus who is without a reliable support system. And that person could be married or not, partnered or not, either didn't have children, often live on their own and or with their partner, or they had children, but for whatever reason, and there are a number of them, adult children or adult family members are not able to help in support because the aging adult has outlived adult family members. There's a complicated relationship. People live far away and can't help out. People are unwilling or unable to assist. And all of those contribute to the challenge of having less people to rely on and connect with as one ages. And so solo aging is really about the critical need for a strong support system. And that makes all the difference in people's lives, health outcomes, et cetera. So one thing we definitely know is that older adults prize independence, and that can sometimes be a barrier to either providing or receiving support. There are a number of statistics and resources that have and research projects that have been done about solo agers. One thing we do know is that a quarter of the baby boomer generation did not have kids. And we also know that we're currently experiencing a caregiving shortage. So we know that a third of Americans between 45 and 62 are single, and that's different than a fifth of Americans in 1980. And of the 92 million older adults, 55 plus, about 15% are folks who did not have children. So that tells you some of the story. Other pieces of why solo seniors have emerged really as significantly is people are living longer. People are having fewer children or no children at all. And people are more mobile than they were in the past. Multi-generational households or neighborhoods are not the same as they were years and years ago. And because of that, there are different kinds of connections that people make, and they can't always either rely on adult children or adult family members, or they're not available at all. So people are making different living choices as well, looking into all different possibilities of housing, from conventional types of housing to more creative co-housing, shared housing, naturally occurring retirement communities, et cetera. And what we do know is that by 2050, there'll be 88 million people over the age of 65. And so it's really important, as Debbie spoke about in the beginning, that we have a sense of what's happening now, how can we enhance resources, and how can we offer the best possible support. So one thing about solo aging is that in general, there historically are 8 different types of support that adult children or adult family members often provide to an aging adult. Those follow in a range of healthcare decision-making, emotional support, help with everyday needs of daily living, financial, residential decisions, and legal matters. And so all of those pieces are things that if someone does not have someone in their support system related to this particular segment of need, it's really important to intentionally connect with people, either personally or professionally, who can help out and provide support for these different types of segments of our lives.
Aileen, before you move on to that next, can you go back to the prior slide? The one that has the 8 different considerations. It looks like it's
Sure.
So comprehensive that these are different factors that we have to kind of deal with growing as an adult in
Right.
America, and to be able to continuously stay up to date with the changes in regulation, policies, changes of our own mental health, changes with what's going on, the resources that's available to us in our community, state, or national level. This can be very overwhelming, I can see, for people who decide to age in place and decide to be or end up being solo agers. So I just wanted to point that out because this is very heavy stuff each
Right.
component here, I could see a person needing a professional guidance or counsel or somebody to just help guide them in how to best navigate that, paying the bills and finances, real estate, legal matters. So I just wanted to put that out because this is pretty overwhelming for somebody, I'm sure, who
Right.
has to live by themselves.
So you're absolutely correct. One of the things that when I speak about solo aging and work with clients on putting together a solo aging plan that looks at all of these 8 pieces, I start with people looking at this and filling in who helps me now, which with each one of these pieces, right? So to do a little brainstorming of when I'm going to a doctor's appointment, when I'm trying to figure out a treatment option, who are the people I rely on to work through some of those things? Who are the people I consider part of my emotional support system? If I have to make financial decisions, who do I look to? Again, either friends and or trusted professionals. Same thing with deciding where to live. And if I own my own home, if I rent my own home, what's the best financial plan for me over time? Who's helping me with those things today? And then as we go forward, who might I want to add to enhance that? Or if there are gaps, I can be aware of that now and make the decisions going forward. So you're absolutely right. Looking at this screen could be completely overwhelming. And we've also left it up for a while, which probably has made people, right, even more overwhelmed. But the opportunity to look at this and break it down and say, okay, where am I with these things? Is really a great proactive way to help with planning. So it's a great point. Thanks for that.
Yeah.
So as I mentioned, Sarah Zeff Geber coined the phrase solo aging and wrote a book, which I have as a resource at the end of the talk. But the book is called Essential Retirement Planning for Solo Agers. And Sarah very cleverly mapped out social networks for those with children. And then the next slide is what a solo ager social network looks like. And so you can see that for somebody with children, there's a different pattern of connection. So as a parent, people are connected to their spouse, to siblings, other family members, to the community, and to their friends. And then they have the opportunity to be connected to their children's friends, parents, community, and that kind of thing. And then again with grandchildren a generation later. And so that expands connections in a way that for a solo ager, it looks different. So someone who did not have children or does not have their adult children or adult family members in their lives, you have a real focus on connection to community, to friends, to siblings, to a spouse or partner, and to other adult family members. And so those patterns of meeting children's friends, parents, etc., the same way. And so again, there's that intentional making connections in different ways than may happen for someone who had children as well. So this is another way to look at the needs for planning. This took the 8 and consolidated them to 6. The same kind of concept, right? When solos are planning, and quite honestly, this applies to everyone. Anyone who considers himself a solo ager, and every one of us, right? We need to be thinking about all these different planning pieces. The reason why I focused on it for solo agers is because of that intentionality, because of that need to plan, to have support where you may where others may have either taken it for granted or expect it, or have already discussed it with adult children and adult family members. For a solo ager, these things have to be very intentional, and you wind up creating family of choice and community as family as well. So planning involves healthcare needs and management. So, and that's navigating the healthcare system in terms of appointments, in terms of treatment options, diagnoses, et cetera. It involves having a diverse and robust support system. And that's diverse in all pieces, with a focus on age. An age-diverse support system is the most beneficial, because if all of our peers are navigating similar things at similar times, we may not be able to be the best support for each other. But if we can rely on folks of different ages and different points in their lives, different people are available to help in different ways. It's important to put together a plan for advanced care, which is advanced directives, things like healthcare proxies, things like do not resuscitate, MOLST, living wills, etc. Residential decisions and transactions, as we looked at in the other slide, investments, financial decisions, money management, and legal matters are all pieces that have to be looked at. As an independent board certified patient advocate, I work with folks on 4 of the pieces of this 6-piece pie and refer folks to extremely knowledgeable professionals for financial and legal. But it's important for it to be included because it's all interconnected.
Eileen, as far as the planning goes, I'm sure you'll say the sooner the better, right? But
the sooner the better, yes. Yeah.
But do you recommend that people also revisit their planning decisions after 5 years, 10 years?
Absolutely.
Things can change, right?
Right. So the idea with planning is that you have to think of your documents, your things like legal documents, your healthcare plans, your financial plans as what's referred to as dynamic, meaning that we don't put together the plan, put it on a bookshelf or in a file cabinet and say, yay, I did that, right? It's sort of a living, breathing set of documents and ones that really require check-in. Unfortunately, there isn't, other than major life changes, there aren't natural prompts to look at those changes. But I recommend that people look at them annually. Hopefully they're working with legal and financial professionals for whom that's part of the practice. When I work with solos on compiling a plan, I also have check-ins with them, from year to year, multiple times a year, to make sure that things are still the way they want them to be, or there are things to be enhanced, et cetera. So it's always really a good idea to go ahead and give thought to, is this still what I need? Are the people I've chosen still able to do this for me, et cetera, and make changes if needed? So it's an excellent point. So health-related wise with solo agers, there are questions about healthcare that are sort of big picture questions and overall health. Will I be able to afford healthcare? Will exercise be enough to maintain physical fitness? How am I going to keep my brain sharp? How do I avoid social isolation, et cetera? Those pieces are some of the big picture questions. And really, it's about planning, which we've talked about. And unfortunately, this is in general something that as humans we tend to procrastinate. But for many solo agers, if they do not have someone to identify in a certain role, they won't plan. It'll stop from anyone from planning. If someone doesn't have someone to identify as a healthcare proxy or healthcare agent, they tend not to do a living will or any other pieces of advanced care planning. And that can be, and so not having someone to identify can sometimes be a barrier. Although I encourage people to do all the planning they can and then go back and identify someone as well. So when you think about planning, it's important to think about making connections now, expanding social networks, connections to programming through libraries, senior centers, medical centers, health departments, et cetera, libraries. Be able to, in the ideal, plan to sustain independence for as long as possible. And also think of yourself as the absolute center of your corporation. And corporations have boards of directors. And we as individuals need a board of directors as well. And that's people personally and professionally who can keep an eye out, can look out for us and make sure financial and medical pieces are in place and supported. So as a healthcare advocate, I think a lot about navigating health and the healthcare system. And unfortunately, there's some pieces related to navigating the healthcare system that can be a barrier for solo agers. So if someone doesn't have transportation to or from a medical appointment, it's likely they won't attend that appointment. Same thing with after having or after a treatment or a procedure, usually that involves anesthesia and we can't sign ourselves out. If you don't have someone to sign you out or drive you home or escort you home, you may skip that procedure, that screening procedure, and that can definitely impact someone's health. People not having emergency contacts or other people to access and trust to access their important medical records. Same thing with knowing about someone's whereabouts and personal well-being and helping with care coordination and management. Those things can all impact anyone's health, but for solo agers, it becomes a significant concern. So I always tell people, and people kind of look at me a little funny, but if you can, and we can, plan for a medical crisis before something changes. We can't change the medical event, but we can change how we will navigate it. So I often recommend to people they have a go plan and a go bag that has information about them in it, spare things like toiletries, phone chargers, that kind of thing. That the plan has all of the essential information about your medical history available so that if you're unable to advocate for yourself, something that goes with you can. It's important to make sure you know who you can rely on in case of an emergency, who might be local and available to accompany you to the ER or while you're admitted to the hospital. As I mentioned, someone to drive someone home from a medical procedure, and all of those things, the delaying of procedures, et cetera, definitely have an impact on someone's health. I am a huge fan of organized documents. We are fortunate that we live in a time of technology and that resources are available through portals and gateways and various systems. However, we can't access that information in medical facilities for a variety of reasons. And so even in 2022, I recommend to people that they have printed paper copies of all of their important pieces of information. and that they consider bringing them with them. So I'm not suggesting someone needs to bring their trust or a will or anything like that you would keep in a safe deposit box, but things like who your healthcare proxy is, who your emergency contacts are, a list of your medications and medical providers should all be easily accessible, easy to find, and able to be taken with you or someone that's going to support you in a time of need. So I always recommend putting together and organizing documents. Another piece that's really essential for solo agers that can really be a barrier are things that are decisional elements, right? So we looked at the pieces that involve navigating the healthcare system in terms of being able to get to appointments, home from procedures, et cetera. But then there are all the other pieces, the pieces of researching reliable resources to know what medical information to access and how to access it in a way that's reliable. How do you figure out costs? How do you know if your bills are correct? If you have a diagnosis, how do you understand and choose between treatment options? In general, navigating the healthcare system is always better with someone else with you, because that person can prompt you on questions, can take notes, can hear information, as well as the patient, et cetera, and also help someone make decisions related to their quality of life and their personal values. That's also a factor when we choose treatment options as well. So the support system is the thing that I get asked about the most, because some of this other feels a little more tangible. It might feel overwhelming to give thought to all of that organization, but as adults, it's very hard to make new connections in general. And so building and enhancing a support system is something that people always ask me, where do I start? How do I figure this out? So in general, when I talk about a support system, I'm talking about people who are in your corner, people that provide feedback that's genuine and in your best interests, and that will have a positive impact on your goals. And so that age diversity is really important as well. So when it comes to building support, it's important to have an informal and formal network. So informal being friends, acquaintances, people you've connected with through book clubs, through library groups, through meditation groups, through attending talks, et cetera, adult ed classes. And a formal network are the professionals who you've connected with for healthcare advocacy, for legal work, for financial pieces, all of those different things. And as Debbie asked about, it's really important to regularly assess that network. I always remind people that when the time changes, we're supposed to change the batteries in our fire and our smoke detectors. And I would love a natural prompt like that for revisiting our documents, that we really should look at those pieces. I always encourage people to think about the buddy system and to volunteer to help someone else before you need the help. So it gives you a sense of if that's somebody who might be useful and a good connection for you. And it's always better to help someone before you need help. It's also good to think about things like volunteering and making sure you have people in place for emergency and non-emergency support.
Yeah. Aileen, before you move to the next slide, I can see I've done programs for various community centers and also independent living, housing, and assisted living. There's different types of there's different type of motivation in the people who attend my program. So the people who go to the senior centers are very motivated. They want to exercise. They want to hang around with friends. They want to learn new things. They want to go on trips. They are just so self-motivated. Now, people who attend my programs in the independent living and assisted living and even low income housing, it's sometimes it's almost like pulling teeth to have them attend my fall prevention program. They just don't seem to have that motivation, or maybe they don't speak the language, or maybe they're not interested. I could see how the buddy system would work for people who are self-motivated. What's your suggestion for people who are not as motivated, or maybe don't have the ability to get from their place to a senior center, or just are very private people? How can they build emotional support?
I think that's a really good point. People access things very differently, and what works for one person certainly does not work for everyone, and vice versa. So it's really great to bring that up. I would say that avoiding social isolation, if that's connecting with a neighbor, someone within your own neighborhood, within your own building, someone you have an interaction with, if you're somebody who visits a library and speaks with a librarian. I understand not having those connections or abilities to necessarily get to a senior center or another location like that. And so really, what community are you living in? And what are some resources immediately right around you? Like I said, neighbors, other people living in independent community living situations, or in various types of housing situations. So who's around me? Who can I connect with? One thing we know in general is that as human beings, not only do we procrastinate, but we also find it very, very difficult to ask for help. Almost everybody, right? And for all of the reasons, Debbie, you suggested, and more. In general, it's hard to ask for help. So to just sort of put it up on a slide and say, okay, go forward, right? I know that that's not right. This isn't ideal. And it's hard. It's hard to say, I might need help with something, which is why if you have the ability, the time and the ability to offer someone else help before you need it, that can be a nice entryway to a connection. So that's also something to think about as well. Yeah. An excellent point.
Great, thank you.
So unfortunately, we've been living through a living case study on the challenges of loneliness and isolation, in addition to the medical impact of living through a pandemic, and we're still living through one. And so there's been a lot of talk about isolation and the impact it has on people's health, both mental health and physical health. And I usually, this one statistic usually stands out to people, that prolonged isolation has the equal effect on someone's health as smoking 15 cigarettes a day. For some reason, that sticks with people. They can either see it or feel it or something. And so, but the reality is that lacking connection, we lose our motivation, our incentive sometimes to maintain our own health in connection with other people. And so it's really important to make a connection with other people. If you go out for a walk in your neighborhood, again, if you connect with a neighbor, et cetera, or a part of different groups, because you can really try to push off some health consequences by making those connections. We know people have impacted blood pressure and immune system functioning when they're limited in their contacts and relationships. And also people tend not to adhere to their medication schedules as well. So it's better for our health to be connected with one or more people if we can be. So when we hear the phrase solo, we may think of it in connotation terms, but the reality is all solo means is one, right? It doesn't mean anything else. It doesn't mean lonely. It doesn't mean disconnected. It doesn't mean anything. It just means one. And so one of the things about aging on one's own is that you get to make all the decisions. You're not somebody who likes to do the dishes. Don't do the dishes. Don't do it to the point of a health problem, but you get to make the choice of you want your laundry on the floor, your laundry stays on the floor, et cetera, right? You get to choose what your environment is like, what your lifestyle is like, without having others to be part of that conversation if you choose that. And you also have the opportunity to be very intentional about who's in your life and what involvement level they have. And that's really another positive piece about solo aging. So we really know that in general, people have fewer connections now for all of the reasons we discussed. And so that really impacts people as they're making different decisions going forward. I always like to make sure people have resources available because there really wasn't, there are a number of people who speak about solo aging around the country. And I work with clients directly on solo aging, but there wasn't a website devoted solely to solo aging. So I created one called the Navigating Solo Network. And what it has events listed for solo agers or that would be relevant to solo agers, including this program. It has articles and videos of interviews with people regarding this topic. And it's really designed as a resource for people who are looking for information without having to Google or look up things all over the internet. It's really designed as a clearinghouse. So I hope people will use it. As I mentioned, Sarah Zefgeber coined the phrase solo ager and has written an outstanding book called Essential Retirement Planning for Solo Agers. It is available in our library system, and I always make sure to let people know that because it's a great book to request if you have access to the library and be able to pick up. And Joy Laverty's book, Who Will Care for Me When I Am Old? Joy lives in Chicago, and this book is excellent as well. Both Sarah's book, Essential Retirement Planning, and Joy's book, Who Will Take Care of Me When I'm Old, have and really a lot of great information. Joy's book is also available in the library system. And these are, in terms of the work I do through my business, Beacon Patient Solutions, I do specific work with solo agers, putting together a plan, facilitating discussion groups, offering talks, etc. And so that's a resource as well. And just to recap is we looked at who solos are, needs related to health and community, how we give thought to creating and expanding our support systems, and challenging loneliness and isolation. And for anyone wondering how to get in touch with me, there's my contact information as well. And Debbie, I'm sure you have other questions or things to share.
I
I'm going to
do.
go ahead and stop sharing my slides.
Okay. Well, that was a very comprehensive presentation
Right.
on solo aging. And, what comes to mind is how there might be some people who are solo agers by what you shared with us by definition and may not even know that they are solo agers.
Mm-hmm.
And to be able to share different types of risk factors and resources that's available for them, I'm sure this will be very beneficial for them. But it's pretty daunting to be able to age in place by ourselves and not know who will take care of me when I get older.
Mm-hmm.
I mean,
right. Joy's book has a perfect title, right?
That title just kind of, oh my gosh, that is so deep. I mean, who will take care of us or me when I get older?
Mm-hmm.
I mean, I am married, I have 3 boys, and I'm hoping maybe they'll all step up. But, there's no guarantee.
Mm-hmm.
No guarantee. And for a person to say, well, I know my friend will be there when I get older, or my nephew's friend will be there when I get older in 40 years. But there's really no guarantee.
Mm-hmm. And that can be overwhelming, right? So all of that information, all of those slides, right? That whole snapshot of solo aging, I can understand feeling overwhelmed. The way I look at it for people in terms of community education is that whole notion of knowledge is power, that if we have the information and the access to the information, even if we want to go back and watch it again, or we want to ask someone for a resource sheet or have a conversation with you about the topic, it's really important to have a sense of, one, that I'm not alone, right? That often when I work with solo agers and people say to me, this is my current, structure. Do I count, right? Am I a solo ager, right? And I always say, I'm not going to issue a card. It's not AARP, right? There isn't a membership, but it's more knowing that if this is your framework as your slice of the demographic, there may be pieces that your friends and other connections aren't intentionally thinking about. They probably should be, right? Because we don't have that guarantee. But for somebody who identifies as a solo ager or newly identifies as a solo ager after this conversation, that they think about those things more intentionally, not as an overwhelming, daunting task, but as I can take hold of this and figure these things out. And there are people who are thinking about this, right? The Aging Strong Falls Prevention Program is thinking about it enough to have it be a topic as part of the series. So that means there are other people thinking about this and plugging people into resources. And so just watching this talk is a proactive step going forward. When people log into a talk of any kind, I always remind them, you may feel overwhelmed, but you've taken a step towards learning about the topic.
That's so true. That's so true. Showing up is half the success, right?
Right.
And talking with as many people as you can about the different topics that you shared with us: financial, legal, health related, advanced care directive, all these different things. Talk to as many people as you can. You don't even have to, don't feel like you have to be friends with them, but just go and talk with experts out there and just ask, what can a person start to do in your shoes? I mean, you could be 50 years old. What can I do as a 50-year-old? Maybe, a person who's divorced, may not have any kids, have no interest in having any other weddings, marriages, or any type of situation. What can that 50-year-old start doing to ensure that their future is, somewhat taken care of in a way? Right.
It also gives you the opportunity in any kind of planning in any of the realms we looked at. It gives you, by doing that planning, you get to go live your life the way you want to. And that's a tremendous gift for yourself. It feels hard. It feels overwhelming, right? One thing is definitely take it little pieces at a time. Prioritize. If for you, having advanced directives, making sure your medical forms are in place is the utmost priority to you, do that first. If for somebody else, I really want to expand my support network is important to you, think about that. But putting those things in place or knowing they are going in the direction of being put in place actually frees us up to really live a more dynamic life, because we're not weighed down by some of these big decisions that we as humans talk about. I need to get to that. I need to get to that. I need to get to that.
Yeah, well said. I mean, it gives us a sense of control, even though thinking about the whole dynamics of what it would take to have a successful solo aging life. But the more we do something about it, the more we're able to take ownership of it and be able to have a sense of control in our lives. Because right now, a lot of people are struggling with lack of control. We don't know when the pandemic's going to end. We don't know what's happening with the financial system and the gas prices. There's just so many uncertainties out there. So the more we're able to take little steps in the right direction towards our longevity, our finances, and the way we want to age more comfortably in place, and also feel like, we know exactly what's going to be happening for us as we get older and older. I would feel better about my life and myself.
Right. That peace of mind factor, right? That piece of having some element of control, especially at a time as you've discussed, is really critical, and also affects our health, right? That's another factor in affecting high levels of stress, feeling out of control, all impacts our health. And we want to make sure people age as strongly as possible, and as knowledgeably as possible.
Yeah. And also, once you do take action, don't forget to complete that whole process. By that, I mean, if you're going to seek legal advice or legal counseling or financial support, make sure you sign it. Right. You can take action, but if you don't complete it with your signature, then it's not a complete and legal document. So I've heard some stories.
And there are lots of ways to access those kinds of resources as well. There are many financial advisors and attorneys who will have monthly visits to senior centers and other community living places as well. That it's not, when we talked about different people having different access to resources in different ways, that's another thing to keep in mind. It's not only about calling a lawyer's office and making an appointment or meeting with a financial advisor in their office. There are other places that professionals do work besides their own office, which might benefit people no matter what access they have to different resources.
Good point. Now, as far as the Massachusetts goes, where does it fall in the number of solo agers as compared to the rest of the country? Do you know any information, statistics?
I don't know specifically. There hasn't been a state by state, although that's a very good idea for a research project. I would say that I have a feeling that the coasts have higher percentages than, the East and West Coast up and down have higher percentages than other parts of the country. one factor in where people choose to live, especially aging in place, or I like to refer to it as aging in community, is access to resources that if you stop driving, if you stop having access to transportation, if you want to live in a walkable city, all of those things. And so that also becomes a factor. So I don't know specifics, statistics for Massachusetts, but I do know I have met in my time working on solo aging, I have met hundreds of people who identify as solo agers.
Okay.
It's a non-scientific study, but
yeah. Now, you mentioned before that because there's a growing number of people who are solo agers. Is the number of people who are solo agers cohabiting? Is that becoming more of a norm, or is that something that's going to be emerging more of?
I would think it's going to be shifting significantly. One thing we know about the baby boomer generation is that what was conventional, right, traditional, quote unquote, all of that is not how that generation approaches things in general. So things like conventional, traditional models of community housing, assisted living, independent living, all of those different CCRCs, continuing care, retirement communities, all of those pieces may or may not offer what baby boomers and other aging adults are looking for. And that isolation factor is also a consideration. And so people are looking at shared housing and co-housing, both of which you just referred to, and something called NORCs are happening. I just happen to really like the word, but the abbreviation is naturally occurring retirement communities, meaning that there's a brand new apartment building. And 4 or 5 people all decide to rent or buy condominiums or apartments in that building. It's not set up as a 55 plus community, but people have intentionally all moved to that building together, 5, 6 people, 2, 3 people, that if they were to need at-home care or whatever, they could share the costs of some of those resources. Same thing with co-housing and shared housing. And so there are some creative models being used to meet those needs as well. So I think to your question, it's really only going to increase.
Oh, I love it. That's so creative. And be able to share the fee, the services for one thing. I don't know, it could be blood pressure checks or, finger checks or, whatever it is.
Or housekeeping or anything.
Amazing.
Right.
That is.
And to have that support, right? You have that individual space a lot of people crave and want, right? They don't want to give up the independent space they have, but they want access to other people and knowing someone's across the hall or on a different floor without having to leave your building or your floor makes a tremendous difference. And so there's a lot of approach to new models of housing in general. The senior housing market is looking at all of these pieces. They've noticed people are creating those too and are looking at creative models as well. And people are empowered enough to take it upon themselves and figure it out for what works for them as well.
Fantastic. I can really see that taking off. That's wonderful. Wonderful. So we're almost at the top of the hour. Is there maybe 1 or 2, 3 takeaways that you want people to really grab onto so that when after this program, they have action steps that they could take to help them be able to really feel empowered and have that sense of control at living as a solo ager?
So one thing the first thing is know you are not a unicorn. Many people think that they are the only, right? That, oh, there are other people experiencing this. I had no idea. So so that in and of itself is really powerful. The other pieces are when you're sitting and thinking, I don't know where to start, think about what you will find most helpful in terms of tackling. If it's signing those documents, as you referred to, Debbie, if it's thinking about more connections in my building, in my neighborhood, in my community, and working on that. Pick something that feels like a priority to you and go very, very slowly with very small measurements of, is that done or not done? And build off of that momentum. And if the momentum doesn't kick in, try again tomorrow or next week. But the notion of it being a continued process is really important as well.
I could see it as being a part-time or maybe a full-time job for somebody to just really continuously talking with somebody, connecting with somebody. How do they do that? Who do they know? Where
Right.
can they go to get more resources? But I really appreciate the books that you shared with us for resources, because that's actually a very simple step that they can go to the local library and borrow the book.
Right. And Sarah's book is this size. And Joy's book, yes, I'm very passionate about solo aging. They're always nearby, is this size. And it's completely accessible. I believe they're both available as ebooks for anyone for whom that's how they prefer to go through books now, but there are also easy ways to access them. And they've been around for a while, so it's likely you could also find them used. If that's also something that could reduce costs, depending on, I like to give people all different access points to resources, right?
Right.
So yeah, they're fabulous books, and I highly, highly recommend them.
Great. Thank you so much, Aileen. Aileen, I want to thank you for being on this program. And I'm sure I'll have you back on again, because you are a wealth of knowledge for people who need patient advocacy and who are solo agers. In the meantime, can you give us your contact information for those of the people who didn't catch it earlier? How can they reach you?
Sure. So my business is called Beacon Patient Solutions. And my website is beaconpatientsolutions.com. You can also reach me through navigatingsolo.com. So you can find me either way, and I am very grateful for the opportunity to discuss patient advocacy and solo aging as part of this series. Thank you for the invitation.
Great. Thank you. Well, for those of you who missed the patient advocacy show that we did with Aileen a couple of weeks ago, definitely do go back and try to watch that. I wish you all a safe and wonderful day. Thank you to the Quincy Health Department for the sponsorship and partnership. And Aileen, thank you again. Bye-bye, everybody.
Thank you. Bye-bye.